I worked a lot.
Not anymore. What you are. I'm the
So please try to fill out the pre-survey as you take your seats. Assalamu alaikum. God's peace be with you all. Good evening, everybody. Thank you for being here. This is we're competing against wonderful weather, so the numbers are a little low. I would like to thank Lieutenant Governor Nancy Wyman. A little story: the last time we had an official event together, it was at the 10th anniversary memorial service of 9/11, which this masjid coordinated, and I was one of the organizers of it. So the Archbishop introduced me to the Lieutenant Governor, who was the chief guest. And she said, "That's interesting. I come to a cathedral and the program is organized by a Muslim and I'm a Jewish Lieutenant Governor only in America," right? So that's the beauty of being in this wonderful country. I also want to thank Quinn Trong, who's been instrumental in making this work, and everybody from the Connecticut Office for Healthcare Strategy, the State Innovative Model Consumer Advisory Board, as well as the Muslim Coalition of Connecticut that are coordinating or co-sponsoring this event. Welcome to the Islamic Association of Greater Hartford. This is also called the Berlin Mosque. We have a community of about 500 that come to our main prayer service, 450 students in our Sunday school, so it's a vibrant community. I think the healthcare question only becomes an issue when somebody gets sick, and it's sad, but I think it's important that we have maybe a follow-up event to this when we can let the community know what an important event this was. As a Muslim community, we've been very involved with healthcare. We formed together with other clergy members. We were involved with Sustinet, which was the state's attempt to have universal healthcare in the state of Connecticut. And it was important that the Muslims participate because Muslims are approximately 1% of the population, about 3 to 3.5 million people, but we represent 10% of America's physicians. And so we should be involved in the healthcare field as much as possible. We worked with politicians at that time, we worked with other members of the clergy, and unfortunately Sustinet was not effective, but for a good reason. And that was because President Obama wanted to have universal health care throughout America. And unfortunately we're seeing hurdles with the present administration, but I think healthcare is still fundamentally important. From the Muslim community's perspective, healthcare is a fundamental right. And after Islam, there was a flourishing of healthcare and education about healthcare. It comes from a verse directly from the Quran saying that to heal somebody or to save somebody is as though you save all of humanity. And as a result, people that you have heard of, like Avicenna, known to the Muslims as Ibn al-Sina, was a physician, and many other things, but also Averroes, Ibn al-Rushd, are Muslim physicians and scholars who were at the helm, at the front of healthcare, and their contribution to healthcare is known throughout the world. And that's what Islam gave, and this model of rounding with a physician comes from the Islamic model, as well as the ijaza system of giving a diploma at the time of graduating from university. All these are traditions from Islam, and it's important as we exchange ideas that we know where we're coming from. So without further ado, I'll let Mike Kaufman, who is the Vice President of the Muslim Coalition of Connecticut, give you a short welcome, and then we'll hear from our Lieutenant Governor. Mike.
Assalamu alaikum, everyone. May peace be upon you. Welcome. I'm just going to be very brief because we have a great lineup of speakers and hopefully discussions. I'd like to thank you all for coming on behalf of MCCT, the Muslim Coalition of Connecticut. I hope to see you all of you at one of our other events, including the Leadership Banquet, the annual Eid Carnival, our shelter serves, our Habitat for Humanity builds, our Taste of Ramadan event. And actually that's all I'll say. So with that, I'd like to introduce Lieutenant Governor Nancy Wyman.
Thank you, Mike. I appreciate that. Get it right? Yeah, thank you. God's peace be with you.
Yeah, put it in
Peace. Shalom Aleichem. That's it. There we go. That's what I understand. So it is great to be here tonight, and thank you so much for coming out. It is so important to have these kind of meetings together that we can talk. I have to admit that I'm going off my script to say to you, I learned more in the last couple of days about what I'm supposed to be doing when I come into the mosque, and thank you for inviting me in. Though I learned so much more because we were talking about integration and how we all work together, and that's really something that many of us have talked about and dealing with. And as I told the doctor earlier, that my questions were as a Jewish woman who that is with some rabbis that won't shake my hand. How do I, what's my reception and what should I do with Muslim men? Because I didn't know if I should. So these very nice women explained to me that I put my hand over my heart and just say hello, and that I should get used to the fact that men wouldn't shake my hand, and that was fine, except the first two men I met shook my hand. And it was okay. I was okay with it. I got it. And that changes, and I understand that. But, and that's where it is also in my religion, because some men do shake your hands. But when it comes down to healthcare, so some of the questions that I asked to the doctor is saying, well, you know what, if the women are covered up, and they stay covered up, similar to in Judaism, when our women wear the shadels, and they don't have their head showing, and you don't touch a man, then how do you get health care? How do women get health care if most of the doctors are men? Can a woman go to a doctor and get their health care? These are some of the issues that really restrict the way we deliver health care in the state, is because of the lack of knowledge of other people's. And some of the stuff that we need to do, Vicki Goltry's in the back, and she's now the head of our Office of Health Strategies, which is a new thing to bring everybody together to break down the barriers. But we need to transition to understand what we can do for all people in the state. And so if anybody looks down, I'm standing on my toes because I'm not used to standing flat-footed. But let me just go back on some of the things that we've been doing, and I know that you've got great people that are speaking after me on healthcare. To me, healthcare is probably one of the most complex issues that anybody's going to deal with. Healthcare policy is interconnected with nearly everything we do as policymakers in this state. And we still have to teach a lot of the policymakers about that. Medicine itself is constantly evolving, as we all know. And patients have to navigate the providers, insurers, pharmacists, and other barriers to care. It's critical, and it is a very, very difficult system. As a doctor talked about, so I started my career off as an x-ray technician. Should have stayed there, I would have made more money. And my name wouldn't be yelled at all across the state, no. But I believe that we need to do more, and most importantly, the barometer of society, and I'm proud of the work that we've done in Connecticut on healthcare and reform initiatives. But before the Affordable Care Act law came in, the governor and I got elected, and he said, you're an x-ray technician, you take care of healthcare. I thought, that'll be easy. Wrong. Because we know when the Affordable Care Act came in, it was difficult. We had some great people working on it, but we wanted to be certain, the governor and I, that every resident had the best opportunity to take advantage of the new law. So we established our own healthcare marketplace called Access Health, CT, and we were one of the few states that took advantage of what they call the Medicaid expansion. With those two programs, we have now put in 300,000 people in our state now have health care that didn't have it before. Yes. And it's not me, it's a group, it's lots of groups of people that got this together. So we had to hear from so many people. And I have to tell you the stories that I've heard ever since they got people that for the first time had health care. How when they went to the doctor for the very first time, and thank God, because they never had insurance before, thank God they went, because the doctors found things that were going on in their bodies that had saved their lives, which is an unbelievable situation in our state. So the ACA was a game changer. It's not a perfect law. I'm not saying that. But the fact remains that in Connecticut, like many other states, there's still challenges. Among them is the minority residents, to how they face healthcare inequities, and that is unacceptable. We need to change that. It's critical that we examine these barriers to healthcare, that we understand how different communities and cultures respond to the healthcare system. Why do people of color have poorer treatment outcomes than white people? Why do women have to seek more care to treat illnesses than men? You know, how do people of different ethnicities factor into a patient's compliance and good care for them? So where's their backgrounds? What are we used to doing as a Jewish person? Tay-Sachs disease is a disease that you look for in Jewish people. You might not look for Tay-Sachs disease in Muslim people. What other diseases are there that affect different people? We are all one in the United States of America, but our differences are still different. But that we have to bring it so that we can treat everybody at the same time. So, what we try to do, how we try to do this is we now have launched a program that's called State Innovations Test Grant, or better known for all of us as SIM, to bring people together for public health strategies and healthcare reforms to answer these questions and other questions. Government has got to be a good partner, but we count on our providers, our advocates, community leaders like we have here, and residents to narrow these inequities in healthcare, lower costs, and improve the quality of healthcare. Being here today is an important part of the work that we are doing at SIM, and it will help us. And part of it is because we need to hear from everyone in the state. We need not to be just speaking to you. We need to be listening to you. So I'm going to cut this off because it's time for somebody else to either talk to you or hopefully they'll listen to you. And there will be a lot of people here that have some great expertise that they'll be here to answer questions if you have them. But here that will be leaders that will bring it back to that gold building in Hartford where we can get maybe some work done, at least on healthcare, to help everyone. So I want to say thank you for having me again today. I wish you a happy year and a healthy one more than anything. God bless you all. I think the next speaker is a very good friend of mine and person that knows so much more about healthcare. Damien, you want to come up and talk to everybody? Thank you.
Good evening, everybody, and let me lower the bar the Lieutenant Governor just set. I am here to share a little bit about who I am, the agency that I work for, how we are here to help everybody in the state, and no one knows about us. And most importantly, here to listen, because that is the one thing that we find over and over again, is that everyone's individual story is unique. everyone's individual story is individual to them, and while there may be a lot of commonalities, that's what we're looking for, and especially as policymakers, it still matters to you, to your loved ones. So what we try to do is get the full picture. And Lieutenant Governor touched on this, the doctor touched on this a little bit. You know, we have, I'll tell you who I am, so you know why I'm rambling on in a second, but I wanted to not lose this train of thought because I do that a lot, my wife tells me. We have a very, very diverse population in our state. I was shocked a few years ago to learn we speak over 60 languages in the state. That's not surprising as I've traveled around and spoken with people, but it does present very unique challenges. A lot of the cultural barriers, linguistic barriers, there's a whole thing.
Thank you.
Point to anything in any industry and there's going to be an acronym for it. CLASS is this one. Culturally, linguistic, actually I can't remember what the AIS stands for now. But the focus of that is to make sure that everyone's unique interests and needs are understood at the point of service, whatever it is. And for healthcare, that's most especially important because if you don't have that level of comfort and faith with the person who you're going to seek help from, that ability for them to help you is going to be limited. You're not going to be as open. You're going to be maybe a little less trusting. I'm that way. I tell my doctor what I think my doctor needs to know because I know more than my doctor does. Right, doctor? I actually was in medicine for over 20 years, and we would have patients tell us very, very often, why are you asking me this question again? I filled it out on the form. I don't think that was me. Okay, good. I filled it out on the form. I told the last 3 people, why am I telling you again? Because patients lie. Patients forget stuff. Example, when they ask you to list all your supplements, there's a reason for that. Vitamins, some supplements actually thin your blood. I worked for a surgeon for many years. People would take high-dose vitamin E because it's really good for your skin, allegedly, but it also thins your blood. So they didn't think they needed to put it down. So that's just one little example of how we as individuals don't really understand. Just like someone coming into an area that we have expertise in. They may not tell us everything that we need to know to effectively serve them. So I'm going to stop with that silly introduction and tell you who I am. So I'm Damian Fontanella. I'm the General Counsel for the Office of the Healthcare Advocate. And whenever I come out and talk to people, I ask if anyone's ever heard of us before. You've heard of us?
I've heard of you.
That's fantastic. No one ever raises their hand. All right, you don't count. Vicky used to be the boss, so she keeps it. Very important to understand. We are a state agency. We work for you. We do not have any taxpayer dollars funding us, so we are not a part of the problem in Hartford right now. Not that there's any problem. And we are free, 100% free. Our focus is 3-pronged. 1, education and outreach. I live for going out, talking to people, listening to people, understanding what the challenges that they face are, and sharing what little knowledge I have as to how to overcome those barriers and to get access to quality, affordable health care when they need it in the setting that's most appropriate for them. Now, we don't get involved in the delivery of care. We focus almost exclusively on insurance. But because the healthcare system, as Lieutenant Governor talked about, is extremely complicated, it's really, really hard to help people and not get involved in a lot of the other aspects of care. And we do that very often. We work with providers, hospitals, the insurance industry, other state agencies. Our goal is to make sure that if we can't help directly, we get folks to those who can help. And also that we understand the challenges that they face, because the 3rd prong is legislative action. We work on policy all the time, from going out and working with the community, individual consumers. Oh, yeah.
There's somebody who's blocking the Lieutenant Governor, so I have to announce this all the time. AK 62178, Connecticut plate. If you can please move your car, you're blocking the Lieutenant Governor.
No, it's fine. So we take all the experience that we get as we go around and talk to people and listen to people and work for people individually as they come to us, and we identify challenges that are being faced. And when possible, we work with our partners in the state and the local community to come up with reasonable, appropriate policy initiatives to get things changed. One example, when the Affordable Care Act came out, one thing you may have heard of is all these preventive services, this free screenings. You can go to your doctor for an annual check for free, it doesn't cost you anything. Well, one of those things was colonoscopies. Very exciting topic, I know. But important for many people. And under the Affordable Care Act, if you met the criteria for potentially being screened, if you maybe had higher risk factors for coming with colon cancer, a colonoscopy would be appropriate. The problem is, while they're performing this free 100% paid for colonoscopy, if they find something, it stops being a screening exam and becomes a diagnostic because they do a test. People would wake up and then they would be getting bills for $1,500, $2,000 because what they thought was free, and probably the only reason they did it, suddenly wasn't free. So we worked in the state with our policymakers to get the law changed. And now, that and a couple other things as well, if they start off that way, they have to stay that way. And one of the reasons we thought that that was so important is because if I as an individual go and I seek help, I seek health care based upon what I believe is the law, what I believe my rights are, what I'm entitled to, and it turns out to be wrong, what's going to happen the next time I might need to get help? I'm going to doubt the system. I'm going to have questions about what I'm actually entitled to, or if the system's even working. And we don't have time for that tonight. But there is a lot of work on the way to make the system work, and a lot of people in this room are dedicated to that. So I'm going to talk more about healthcare and how you access the system. But just so you know, because I want you to remember this, because I talk a lot, and people always forget who the Office of the Healthcare Advocate is. So we've been around since 2002. We've helped an average of about 7,000 people a year, thereabouts. And they've come to us for a host of reasons. They don't understand the plan, they can't get signed up, but most commonly one of the things they come to us for is they've been denied something by their insurance company. They had surgery, or they need prescription filled, or some health care service. And their insurance company has said, that's great, but we don't think you need it now, we're not going to pay for it. Or your plan doesn't cover it in that way, or something. And they got a bill much bigger, just like the colonoscopy bills, than they expected. And they felt that they needed to have someone advocate for them. Of those people that have come to us over the last 17 years, I guess now almost, we have managed to save over $90 million. We have an agency budget of just over $3 million. So last year, $3.5 million was our budget, no taxpayer dollars. Full disclosure, it is built into your insurance premium, so I'm sorry for the fraction of a percent if that's our fault. But for a $3.5 million budget, we saved the people that we worked for last year over almost $11 million. That is important because healthcare affordability is one of the bigger challenges. So the Office of the Healthcare Advocate, if you ever have questions about insurance, coverage, you've been denied something especially, call us. I've got a bunch of materials up in the main entrance on a table, brochures, pens, fun little swag for you to bring home. And if you ever want us to come out and speak to a group, small, large, whatever, about challenges that you're facing, call us. It's what we do. So I want to talk a little bit about insurance, because that is mostly what we deal with. Most people in our state, thank God, especially now thanks to the Affordable Care Act, a lot of the initiatives that come from the federal level, hopefully stay, as well as the foresight of our state's policymakers, both in the governor's office, lieutenant governor, spearheading all of that, and a lot of the legislators in the General Assembly have done some very important work. We have very, very low uninsurance in our state. Still too high because it's not zero, but most people have some form of insurance. Most people also don't really know how to use their insurance beyond the average. I'm going to see the doctor and I'm going to pay my copay and that's it. And for the average healthcare access that we need to use, it's straightforward. But healthcare is very, very complicated and becoming far more complicated by the day. Anyone in this room ever have problems with affording healthcare, either your premiums or a deductible? You don't have to raise your hand, but affordability remains the biggest thing that we hear, especially around the open enrollment time, because the landscape around health insurance has changed dramatically. Just making sure I'm not going to talk too long. I am a lawyer by training. I try not to pull that out there, so I pull that out a lot. But people struggle with affording healthcare. Just getting their insurance is a challenge alone. Since the Affordable Care Act passed, one thing I'm not a huge fan of, although I understand it, is that there is now a defined open enrollment period. You have to sign up during one very short period during the year, otherwise you're out of luck unless you fall into a couple fairly small buckets outside of that period. That leaves people who don't understand that. That leaves people who don't understand what their obligations are, as well as their rights. Oftentimes out of luck and uninsured for the entire year. And not because that they didn't want insurance, they just didn't understand that they had a very defined period to sign up for it. Or maybe they were struggling with enrolling, figuring out what was the most affordable plan for them. One thing we do a lot of, starting around October, running through December, even into January a little bit, because that's right around when open enrollment happens, is coaching people, educating people about what they are potentially entitled to. And anyone who's looking for insurance next year, or if you think you have an event where you're losing your insurance now, you might qualify for something else now, go to Access Health Connecticut, because they have screening tools that can take your information and tell you exactly what you're eligible for, including assistance from the federal government. I've had people come to me that said, look, I want to sign up, but I can't afford a $1,500 a month premium. That's what I was told it's going to be, and I just can't do it. And that's with like a $6,000 or an $8,000 deductible. Everyone know what a deductible is, by the way? That's a question that you'd be surprised more people say no to. May not admit it, but they say no to it. One thing I try to coach people on is when you are looking at a plan, look at the monthly premium, that's one thing. Then take whatever the deductible is, divide it by 12, and add that to your premium. Because a deductible is the amount of money you have to pay, just like your car insurance or your house insurance, before the insurance will start paying for anything, unless it's one of these screening preventive services. So if I have a $1,500 a month deductible and a $6,000 or a $1,500 a month premium and a $6,000 deductible, that means I have to spend $2,000 a month before my insurance will pay anything. That doesn't help them. People still put off seeking care, even when they need it. Forget about going for preventive or regular checkups. People will defer filling prescriptions, which is a huge problem for many of us in our society. People will avoid getting routine evaluations of things that could be managed far more effectively before they become more complicated, more difficult to treat with longer consequences. These are all challenges that have nothing to do with the individual's willingness or desire to seek help, and everything to do with their understanding of what's available to them and their ability to afford the care that they need. And there's a lot of programs. So the person that came to me with that $1,500 premium, once we went to Access Health, it turned out she was actually, her and her kids were eligible for, I think almost $1,300 in assistance a month. Her premium was just over $200. And her deductible was half of what she thought it was. There are a lot of resources in our state. Don't ever assume that there's not somewhere to get help. There's still a lot of challenges that we need to overcome, and that's one thing Mark's working on, and many others in the state. But always assume somebody might have another answer for you, and come to us. And if we can't answer it, we will find the answer for you. We are here, we are free, and we're not going anywhere. So that's one reason you need insurance, because healthcare is really, really, really expensive, especially if you don't have insurance. I'll share a little personal story. So I was diagnosed a couple of years ago with a very fun disease, and in the last couple of years I've racked up over $500,000 in medical bills. That would have been impossible. I would not have been able to get the treatment that I've had if I did not have insurance. Fortunately, I work for the state, which has good insurance, but any plan would have been better than this. I remember the first year I worked for this company, I had a woman call me, mother of 3, married 15-something years, had been diagnosed with ovarian cancer. I think it was stage 3 or something. And she was making a choice as to whether to pay the mortgage or start treatment. That was a choice this woman was seriously making. Am I going to worry about paying for care, which I don't think is going to help me, because she was depressed at that point. She'd just been diagnosed. And while I'm trying to get this futile effort done, I end up putting my family out on the street after I've gone. And that's not a decision that we should ever find to be acceptable in our society. This is America. People shouldn't have to think about mortgage or health care, saving my life or putting my family on the street. After we worked on things and found out what options she had, she actually was able to get the services that she needed. So insurance had denied the coverage. She's fine. She was treated well, and I mean, as a couple of years ago, at least she was doing well, no problems. Mortgage is still being paid, still the same house. So that's one story that I always like to go back to, because you never quite know. And things often are never as dire as they may seem. I rambled too long, so I'm going to wrap up with a couple quick things. You are your own best advocate. I'm a great advocate for you. Call me, I'll do everything I can. I'll move heaven on earth and I yell at people all the time for you. But you are your own best advocate. Understand your rights. Understand your obligations. And by that I mean, know what your plan actually covers. Ask questions. Never assume anything. And no, nothing personal, but doctors mean well. But doctors come at care from a completely different perspective than insurance. Just because your doctor says, this is what I think is the best thing for you, maybe the newest, most innovative approach towards some treatment, it may be pretty new. The insurance companies are obligated to minimize the risk, because if they spend a lot of money on things that don't really work very well, they spend more money. Spending more money means the premiums go up the following year, which means more people struggle to afford them. So it's kind of a vicious cycle. It's really like a house of cards. It's a very complicated issue. But understanding that the insurers have very specific rules. Your insurance plan is a contract. They're obligated by law to provide care and pay for that care for you, as long as you pay your premiums and there is medical evidence that you need that service and it's been supported. So be empowered. Ask questions. Look for help, like us, if you need it. Never assume there's no one out there. And a lot of the things that will help you do that more effectively in the future, we have been working on for the last 2-3 years. Mark Schaefer, the director for the State Innovation Model, is moving some very important initiatives along in the state, which I think we're going to be very excited to see. And he's going to come up and share a little bit about what they're doing. So I'm sorry I rambled. I will be here to answer any questions. Thanks.
Great. Assalamu alaikum, everyone. I'm Michelle Muhyiddin, and for the rest of our time together, we're actually hoping to look at healthcare in a different way. So we've had people come up here talking to you about what the state is doing, but in order for them to really accomplish that, they need to hear from you and see what your needs are. So I wanted to talk a little bit about myself. Most of my life, my experience with healthcare has been as a patient. So I know growing up, came from a Muslim household, so the doctors that I saw were Muslim. And I'm sure a lot of you can relate to that, because most of the time we go to doctors that we can identify with and healthcare providers who we feel are gonna kind of know where we're coming from. For example, during Ramadan, we fast all day. And so if some of us have, say, diabetes or other healthcare problems that require medications that you have to take at certain times because your life depends on it, maybe a provider who isn't sensitized to our religion, who doesn't know where we're coming from, may not understand why we're asking to change our dose timings so that we can take part in this very spiritual time of the year. So that's kind of the background that I've come from, that I know a lot of us are coming from. And more recently, I've had the privilege of being a medical student, a third-year medical student at UConn. And I've learned a lot about how to provide patient-centered care. And I know as patients, we hope that our doctors are listening to what we're saying and they're not just prescribing or trying to fix a problem. And I know from like the first month of my training, one of the things that we started doing was they actually have a little area at Yukon Health Center where they hire patient instructors. So these are normal people who they train to act as patients coming in presenting with a whole array of diseases, and we're trained on how to interview them. So from the beginning, we're really taught how to talk to our patients and focus on listening to them rather than shooting out questions, yes or no, that require yes or no answers. So at the end of our little role play session that we do, the feedback that we get is really helpful. And one of the most common feedback that we get is please ask more open-ended questions. Because, asking, do you take this medication versus what are all the medications that you take and vitamins and supplements, that can really make a big difference in the kind of care that you're going to give them. So during this time, I learned the value of listening, of understanding my patients, including all of their attitudes and values and beliefs, and of course faith and their spiritual lives. And so as providers, we do feel that patients need to be partners in their care, and they do need support in making those decisions. And these aren't decisions that at least doctors or healthcare professionals can do on their own, because it's important for you to take an active role in your healthcare. So tonight is really about listening to you and learning from your experience with healthcare so that we can make healthcare better for you. So having said that, I'd like to introduce Mark Schaefer. He's a PhD and the Director of Healthcare Innovation at the Connecticut Office of Health Strategy. And Mark's job is really to find ways to improve healthcare here in Connecticut in our home. And he's going to tell us a little bit about how our patient stories and your patient stories can help him to do well at his job. So please introduce Mark. Please welcome Mark.
Thank you so much, Michelle, for that, for talking about your own experience and about your experience as a medical student. I think that that idea of patient-centered care and listening to patients is so important, and it's a big part of why we're here tonight. Before I go too far along, I really want to thank Dr. Mansour and the Muslim Coalition of Connecticut and the Berlin Mosque for making this possible. This is our first ever conversation with members of the Muslim community, which I know is a huge and diverse community. And I'm sorry it's taken us 3 years to have this conversation. I'm hoping it's the first of a series of conversations to get your input over time in terms of how do we try to make healthcare better. So how many of you have a usual doctor you go to for your care? So more than half, which is great, because it's important to have a usual doctor. That relationship, somebody who knows you, is really important. How many of you have ever had a major health problem, or somebody you love has had a major health problem that they really depended on the healthcare system? So maybe half of you, and the rest of you are pretty fortunate not to have been in that situation. So I find, I didn't know this, I think, when I started my health policy work 20 years ago, but over the years I've learned how important it is, how much we can learn from listening to other people's stories and also from my own stories of problems that my father had and more recently my mother, that really provide a view of how the healthcare system sometimes fails to serve patients. That's really important to pay attention to, because if we're going to try to improve things, we have to look at it through the lens of patients. In the same way that Michelle says, in an individual patient situation, you need to listen to patients. When you're sitting where I sit in a policy perspective, and I'm talking to Anthem, and I'm talking to Medicare, and I'm talking to Medicaid, we really have to understand your experience of healthcare. And just because I'm concerned about time, and I really don't want to short shrift the amount of time you all have to gather into groups, I'm just going to tell the sort of a really brief story. And I'm also going to do a time check. So we are it's about 55 minutes to 7:30. Do we want to try to organize things to make sure we stop strictly at 7:30, or can we run 10 minutes over, or sort of Okay. So we'll try to have you breaking your fast by 7:40. So just about my mother. So about 8 years ago, she was in her early 80s, and she, in about 8 weeks' time, developed there's a part of the story that nobody wants to hear about. It's the diarrhea, really loose diarrhea. You know what that is, loose stool. And so it's important because, as embarrassing as that is, it's also life-threatening if it goes on for a really long time. And so she developed this in her 80s, and nobody could figure out why, but they looked in her intestine and they found out that all the little hairs that are in there that need to be there to take out the food and the nutrients were gone. And they diagnosed her with celiac disease and they sent her home. Well, celiac disease has really strict dietary requirements. Now she was over 80. And if you've ever tried to teach a 20-year-old to follow a strict diet, think about an older person living alone being told, you have to cut all the gluten out of your diet. So figure it out. You know, you've had your 7 minutes with the specialist, now go home and figure it out. Well, she didn't do a very good job following a gluten-free diet. She also, along the way, they said her gallbladder was acting out, so a couple minutes later they took out her gallbladder, which actually had nothing to do with the symptom. And she didn't know that. She didn't understand that surgery had nothing to do with that. She then had a series of hospitalizations, and her concerned family members, I'm in Connecticut, she's in Michigan. I called the doctor that she has gone to for the past 20 years, and I said, is there anything you can do to help stop this series of hospitalizations? Is there something you can do to help coordinate care? And the doctor says, we just don't do that. I don't have any way of doing that care coordination. And we were feeling pretty helpless in Connecticut. There's this cycle of hospitalizations. Every time she goes into the hospital, she meets a different doctor who doesn't talk to her primary care doctor. And some of the hospitalizations were actually avoidable. So every time she'd leave the hospital, she would have this problem that I talked about, and it would mean she'd get dehydrated and her kidneys would fail and she'd go right back into the hospital. Something you could actually avoid if you actually tried to. But hospitals get paid every time they admit a patient. They don't get paid for avoiding admissions, right? The hospitals get paid for admitting people to the hospital, not for keeping people from getting readmitted. So those kinds of things tell us something about, well, the payment thing is a problem. If I have my car fixed and it has the same problem in a week, I don't have to pay for it again. The mechanic will fix it for free. The way we pay for care is part of the problem. The way primary care works, that primary care doc doesn't get nearly the support he needs to, or she needs to be able to coordinate care for patients who have more complicated needs. I learned about how important it is to educate and figure out after the visit how you make sure that an 80-year-old woman is following the diet. Somebody might have to go to her home and say, we're going to throw out this and this and this and this because you can't cook with this anymore. And these are the things you can cook with instead, and we're going to show you how to do it. If those things don't happen, you can't possibly get a good outcome. And then the other thing is, did she really know that the gallbladder surgery had nothing to do with the problem she came in there in the first place? I told this story not long ago to somebody, and in the audience they said, you know what, my mom had the same thing. And this was actually all caused by a hypertension medication we learned, a blood pressure medication. She actually died on the table of the surgery. And it was an unnecessary surgery. And so it really matters, getting the right care and being fully informed really matters. And so you hear a story like that, I have that story in my mind, and I have countless other stories that I've heard from other people that provide me with a window into what we need to do to make healthcare better. So, for the time we have, and we have about an hour, we've got a few people who volunteered to be facilitators tonight. We're going to break off into smaller groups. And what I'm going to ask you to do is something you may not be used to doing, which is in that small group, go through some questions and talk about and think about your own experience of healthcare and whether there's something, if you had advice to give me or advice to give your doctor, what would it be? And so Dr. Mansour, and Mark Tour will lead a couple of men's groups. So you can break off maybe one end of this table, one end of this table. And then Ilaf will lead a group that speaks Arabic. And Michelle will lead a group that speaks Udan? Urdu? That's a noodle, I know. Okay, Urdu. Apologies. And I don't know whether we have any other language need.
And why?
Just when I feel that I need to go. I give myself, yes, absolutely.
Yeah, so I have a PCP, so whenever I need to go, I basically first... Anybody does something different from PCP? Huh? So anybody goes to the ER all the time when they have a problem?
So I feel safe I do feel safe around the doctors because they know what they're doing. They're good at taking care of you, and they're good at looking after you when you're sick. And my dad's very good at being a heart doctor. He's very good at what to eat, how to eat healthy.
I know like they have everything in the chart, like your information and things. I'm missing that relationship with my I amplify like someone that knows me, knows my background, knows what I like, what I don't like, what I'm interested in.
और जब भी होने वाला मैंने वो मदद से सारे डॉक्टर्स के और मैं इसका इनाम पाया जब फिर वो भी आया मेरे पास मेरे एक फिल्म के बाद वो पीए को लेडीज भेजता था कि जाओ ये चेक करके आओ ये आके बोलो और उसकी आवाज़ तक मुझे नहीं आती इसका मतलब रेस्पेक्ट करते हैं I do read labels of anything and everything, and if there are some medication that I'm uncomfortable with and I do ask, is there gelatin? The pharmacist. And most vitamins I do try to buy that are vegan or kosher. There are lots of vegan vitamins and kosher vitamins. Or and supplements, alternatives. And even like cough syrups, yes, no alcohol, especially like the children's version of it. They don't have any alcohol.
But you know what? Majority of the people don't know.
Well, that's why we're here.
Yeah, majority of the people don't know about before.
The reason is, doctors are wasting so much time just answering the refills, doing a prior authorization. I mean, I got doctors, they call me, and he's telling me, I saw the patient, I wasted half hour on them, I prescribed them X drug. The insurance doesn't cover it. You tell me what I should prescribe that gets covered. I don't care, just get it covered, and I can't keep wasting enough time on this issue. If the patient's not gonna get the drug that I decide or think is the right thing for him, and these are not cutting-edge medications.
No, they're not doing it deliberately. It's the system.
Exactly. So what I'm saying is,
what you're saying is correct.
As you are a victim, I think the medical professionals, like doctors, are also. I have to dispense about 100 scripts an hour. You know how much? It's 10 seconds prescription.
So we had this group over here, as you can see, they're all males. So we had a limited experience. So shall we just go through the questions, Quinn? 1, 2, 3, 4, 5. Where do you go when you're sick? Most people go to their PCPs and are very happy with them because obviously they know most about their health. Some go to the emergency room if in emergencies. Some go to the walk-in clinics if they when they didn't have a PCP, but mostly PCP. Do you always feel welcome at the doctor's office? Most people said yes. Yeah, there wasn't anybody who didn't. How comfortable are you with your doctors? Most people felt very comfortable with their doctors. I think there were particular religion-associated issues. For example, Muslim women preferred to see a Muslim female physician, unless obviously there wasn't, but that was one issue. And male patients would prefer to see male physicians. If you could give your doctor advice about how to make you feel more comfortable, one was that they couldn't get an appointment with their physician quickly enough in case there was a problem, that it took them longer. Some wanted to see their physicians but were getting nurse practitioners instead. And obviously it's a different person. It's not that they were against nurse practitioners, but it's a different person than their primary care physician. And sometimes some people felt rushed, right, with their appointments. How does your faith affect how you use healthcare? Most people actually didn't think that it was, apart from the language issue, the gender issue, they didn't have a big problem from a faith perspective. Sometimes language became an issue. For example, older parents that only spoke a particular language, there was a barrier there. What makes it hard for Muslims to use healthcare, that we dealt with the women preferring women, men preferring men. But from a religious perspective, if you're in a crisis, there's no problem with you seeing people of the opposite gender. It was just a preference, and I think that's a preference not just among Muslims, but among all people. Probably because of the modesty issues, it's probably more in the Muslim community. How can doctors help the Muslim community in the healthcare field? Actually, they didn't feel like this was an issue. They felt that the doctors cared for them, and the faith didn't really play a big role in that. Have you ever had a bad healthcare experience? There were two. One was a person who had an issue with dry eyes and was charged a huge amount but didn't fix the problem. And the second was a dental issue where the dentist referred him to a specialist, or referred the patient to a specialist, and they made a mistake and said sorry and gave them the money back. And that, I guess, was a bad experience. Anybody have a good experience? Everybody had a good experience. So I think that's us.
Most of the questions were answered over there, like, who do you go visit, if you're sick. Most of them, they said urgent care. Then they want to go to emergency room. And the other one of them is a new one that I never heard before. It's a telemedicine. And others say that you call a friend, a doctor friend. I call Dr. Mansour all the time.
So we don't hear much about people using telemedicine. So who used telemedicine?
Just to bring everybody up to speed about what we were talking about. When we were talking about how people get care, one of the members of the table we were talking about, it's part of his insurance plan that telemedicine, a call-in phone number 24 hours a day to get medical attention, medical help, and medical advice is in his insurance plan and is no charge. So he opts to go to telemedicine first prior to using one of the other methods.
I'm going to talk about complaints mostly, okay? So
We had a lot of complaints.
A lot of complaints. So one of the complaints is that when you go visit your doctor, how much time do they spend with you? It's like 10 minutes and they get rid of you. And the other thing that we talked about is if you're a minority, what they do, the doctors, instead of going, telling you what kind of diet you should be or that stuff, all they do is just prescribe a medication and they send you to a pharmacist just to give you the medication just to get rid of you. And that's how they felt. One of the, we asked the question about what do you think about your doctor? The doctors, are they helping you or that stuff? Is it the doctor's problem that you have all these issues? The suggestion came, it's not the doctors, it's the insurance companies. Because they stress the doctors, to just get more, prescribed medication and decide whatever they have to decide as soon as possible. And those are the things. Thank you.
Assalamu alaikum. Bismillahirrahmanirrahim. So I had a young group, and where do you go for health care when you're sick? I had 3 who go to their pediatrician, 1 who goes to her primary health care, and 1 who goes to the hospital, but her father is also a doctor. How they felt in terms of being welcome, all of them felt very welcome at all the places that they go. And they are very comfortable asking their doctor questions. One is particularly more comfortable if her mom isn't there. If you could give your doctor advice, all of them said that the only thing about making them more comfortable was just making them aware of some of their modesty issues, if any came up. But generally, they feel pretty comfortable. And how their faith affects how they use health care, they said they don't think that Muslims have any problems using health care, and how doctors can make the Muslim community be healthy was an issue of mainly on advising about diet, because they are aware that a lot of their ethnic diets are not the healthiest, especially in terms of the use of oil and frying. And so they would like it if their doctors knew things like about what the various ethnic communities tend to eat, so that they could advise them on that. And also things like knowing about Ramadan. And so if you're advising a patient during their fasting time, knowing what fasting is all about and what they can and cannot do would be really helpful. But they would feel comfortable letting doctors know these things, but they would love it if their doctors knew these things. And in terms of whether they ever had a healthcare experience that didn't go well, the culprits seemed to be dentists that overcharge for unnecessary things and drag out the procedures. That was the only thing. There was one person who did feel that their doctor wanted to do an unnecessary biopsy, and she just switched to another doctor because she didn't feel that was necessary, and she got treated and with just medication, and it was fine. And last of all of them had very good healthcare experiences that they shared, and felt that they're pretty pleased with the healthcare that they've had.
Where do you go when you are sick? Many people said PCP. And one person said their mom. And then the mom asks questions with the other sisters, and then they find, sort of make a decision of what to do. Okay. No, just not. And just get some ideas of what other people are doing. Do you always feel welcome at the doctor's office? Why or why not? Most people said they felt welcome. There can be issues with regard to gender and with regard to language. So for instance, if someone is dressed the way we're dressed, there may be people just sort of thinking that this person doesn't speak English. And when they speak perfectly good English. So there can be those issues. So gender and modesty issues over the gender. If you could give your doctor advice about how to make you feel more comfortable, what would it be? Again, just to sort of, if they knew something about each person's faith, a little bit of sensitivity would go a long way. And so things with, like for instance, diet, as you mentioned, during Ramadan, etc., would be very useful. How does your faith affect how you use healthcare? Someone mentioned the fact that we shouldn't have gelatin, and also that we shouldn't drink alcohol. And so sometimes medication is alcohol or gelatin based, and it should be important to be aware of those things. If the physician knows the sensitivities and if it can provide an alternative, that will be also very useful. Let me see. So that's about faith and healthcare. What makes it hard for Muslims to use healthcare? Again, gender issues, language. Also. Okay, so now we're going into the how can doctors help the Muslim community be healthy? Again, it was basically if they knew more about what we were doing and how our community was. In terms of, now we're going to go straight into the negative stuff. Have you ever had a healthcare experience that didn't go well? One of our group had a young child who had a viral GI issue, and she was in the ER for 2 hours. And then they kept on trying to get a vein. They couldn't do that, and then she realized that it wasn't a pediatric facility, and if they had just suggested her going to a pediatric facility, it would have made it much easier. In terms of the positive, one of the very positive things that a lot of people around the table spoke about was CCMC, the Children's Hospital, how very positive it is, how very friendly they are, and how very welcoming they are of the community, and how they really try to help the kids. And I'm from my own experience, taking my daughter for surgery there. I remember when we were just filling out the forms, they had a special thing for her to blow bubbles while I fill out the forms. And even when she was about to go into the operating theater, she actually got into a car and drove in. So That's the positive. Okay, thank you.
For number one, people saw a range of people: pediatrician, ERs, doctors, PCPs, urgent care. And actually, we only got through 3 questions because we talked a lot about issues. Most people in our group were really great advocates and felt comfortable at the doctor's office and felt comfortable advocating for themselves. And so we talked a lot about why that is and why this group was extraordinarily great at self-advocacy. And then we heard a story about a mother who struggled with doctors who lacked some cultural and other kinds of sensitivities, and how that really made her experience with the doctors very difficult. And so, let's see what else. And the biggest advice from our group was, doctors should leave their biases at the door. They shouldn't make snap judgments about people based on the way that they're dressed or the way that they speak. There should be some level of cultural sensitivity. So that's what we covered. Thank you.
So for the first one, they said generally going to their PCP, but if it happens at night, then they might go to the ER. For whether or not they feel welcome, they mainly feel welcome unless it's their first time going, then they're a little nervous. We did go off on a little tangent about people who are here on visitor's visa and their access to healthcare. Someone mentioned that Yale has a pretty good program that allows you to get healthcare, and then it has a minimal charge that you can pay over time. So maybe someone can talk about different resources available to those that don't have insurance or don't have status. Let's see. They're generally comfortable asking questions, especially if it's a female. One issue that popped up is someone had a mark and they felt like the doctor assumed it was related to a domestic violence issue. And they were worried that the doctor felt like they couldn't speak up about it because they're Muslim and Muslim women are oppressed. So the next time she went to the doctor, they gave her a survey about whether she was happy in her relationship and her relationship with her husband. And she said that annoyed her because she would have answered her if she asked her the question more directly. Generally, they're satisfied. Someone agreed with the gelatin and alcohol comment that someone made over here. What makes it hard for Muslims to use healthcare, they said it's not hard. Islam gives us ease, so it's not very restrictive. You take what's available, so everything is permissible if it's out of necessity. The main thing that was echoed is understanding our culture, understanding our religion, so more religious awareness. For example, if you refuse to shake hands with a male doctor, then they need to understand that and not get offended. A positive experience is somebody went to a male dentist because the male dentist had a really good reputation and her husband told her that that would be a good idea. But even when she went, she still felt uncomfortable and the doctor could sense that. So as she was checking out, he told the lady up front that it might be better if she switches to a female provider, and she really appreciated that he picked up on that. That's it.
So we'll break for prayers for 5 minutes and then we'll be back as soon as we're done.
So they felt that they feel more comfortable with Muslim or Pakistani doctors, mostly Muslim, and especially doctors that can speak their language, because they feel even though there are services, interpreter services, they feel like their message doesn't completely get across, and the feelings that they're having aren't being translated completely to their provider. So they really appreciate, especially a Muslim or someone who speaks their language.
Did they say who does the interpretation?
So I think there are, especially the formal interpreting agencies, and then sometimes they just maybe have someone in the office. And so in general, one of the issues they talked about was this time limit issue, that the doctors, especially that had, back-to-back patients, they were overbooked. they were more interested in getting to know the problem and fixing the problem rather than taking the time to talk to the patient and understand, where they're coming from, what the issues are. So I think one of the major issues we talked about was just listening and empathy, which they felt like was lacking a lot of times. But they also felt that some of the providers that they have seen that did take the time to do that, they felt like their relationship was better. They felt that in general, they just feel more comfortable with Muslim doctors because of that empathy, because of the cultural sensitivity. But there were women who have taken their kids or have gone to non-Muslim doctors, and the reason why they stuck with them is because of that empathy. They feel welcomed when they come in. They feel like, they're happily greeted. They're taking the time to listen to them. So I think that was a major theme that we found during our conversations was just kindness. So in terms of experiences, there were positive and there were negative experiences. One of the positive experiences was one of the ladies who takes her kids to the specific pediatrician because he will sit down and ask the kids their likes, their dislikes, get to know them as a person. And she feels like that really makes a difference because the kids are more engaged and she can see that the doctor is more engaged. And she said she would even take her child to him for counseling because she feels like a rapport has been built because of this physician's willingness to kind of interact with the child on that level more than just, and the doctor or the patient and on a more personal level. There was also another one that I actually thought was important to bring up. It was a mental health issue that someone went to their doctor, told them that, I might be going through some sadness or depression, and their doctor actually sat them down and said, I'm really happy that you came to me to talk to me about this because this is really important and this needs to be treated just like if you have diabetes or if you have hypertension and you need to take these pills daily as if you have that kind of a condition because this is just as important as that. And she said that it made her feel so comfortable and so willing to talk about it more because of this interaction that she had with this provider. Someone else who talked about that same mental health issue said that the doctor that she went to actually was like, oh, you're just stressed, you're just worried about the kids, don't worry about it. Like, it'll, just go to your day-to-day activities and it'll be over with, don't worry about it. And so she didn't get a good feeling after that. So that's like a good kind of comparison to see. We got a lot of suggestions for what they would like to see in terms of making healthcare better for them. So they felt that, especially for our group, since they were Urdu speaking, they really appreciate an Urdu speaking provider or someone in the office who can communicate with them and relay their feelings and what they're saying in an accurate way. They feel like that's really the most important thing for them. And they just feel that sometimes interpreters are just not helpful. And then they were also talking about health education. So sometimes they feel that, the doctor is giving them this medication, but not really explaining why they're taking it, why they have to come in every few months and get checked up for it. They just feel like the education isn't there. The doctor isn't explaining exactly what the next steps are for. So they would appreciate that. And the specific suggestion that was made was they feel that it would be really helpful to have health fairs here at the masjid, at the mosque here, because a lot of these people, their parents come from overseas and they don't have insurance necessarily when they come here. And so they would just like an opportunity for screening to bring them here if physicians can donate their time, especially language, like people who can speak different languages, and just do kind of like a health fair, like blood pressure screening, like dental screening, that kind of affair that I know lots of different areas hold those, and they feel like it would be really helpful to have that here every several months. It was really nice to see how open they were, and they felt that this was a great way for them to feel like they're being heard. So, yeah.
I'd really like to thank all of the groups for providing such rich information and for taking the time to really talk through all these questions, and for our facilitators who really helped, I think, to to sort of walk through it, and I think from all the rich information we got, they were clearly very good listeners, and which was one of the highlights of what Michelle said, is the importance of listening and having people feel heard. So thank you so much for what you've offered. We're going to not only take what we've written down in these charts, but we're also going to take the more detail that the facilitators gathered, and so that we can basically pull all this together in a summary of what we learned from tonight's event. So if you have any questions for us, if there's anything you want to follow up on, we can get our contact information out so you know how to get a hold of us if there's anything that you weren't able to say that you want to be able to say, or you want to see the summary. So thank you again so much, Dr. Musa.
Okay, so on behalf of the Islamic Association of Greater Hartford, I would like to thank you very much for attending this, but also thank our guests who came and spent their Saturday evening with us. Thank you very, very much.